So they're not doing studies about people who have died during COVID. They're not doing the studies that everyone wants them to do, just like they're not studying where the virus came from. As Jeffrey Sachs told us, nobody wants to find out where it came from. And the reason is because they probably invented it themselves and are guilty for killing millions of people. That's why. And they don't want to do these postmortem, but they are finally starting to do them. I think this is from Germany. Autopsy-based histopathological characterization of myocarditis after anti-SARS-CoV-2 vaccination. Cases of myocarditis diagnosed clinically by laboratory tests and imaging have been described in the context. So here's John Campbell, and he's going to explain it to you. I have it sped up. So he's going to explain all this to you in a way that doesn't get my channel taken down. So watch this.
Well, welcome to this talk. Sunday, the 4th of December. Now, the definitive way to diagnose in medicine, unfortunately, is a post-mortem. We can see what's going on. And this is from a post-mortem series from Germany. Now, this is a lymphocyte aggregation. So collections of lymphocytes, these white blood cells, in the intraventricular septum, that's the bit between the right and the left ventricle, of case 1, with associated myocardiocyte, that's heart cell destruction. So what we're seeing here is these are the lymphocytes that shouldn't be here. And here we see the damaged heart muscle in a person that was found dead at home within 28 days of COVID vaccination. And the implications of this we're going to talk about shortly. But this is the photo. This is definitive evidence. This is from a group of eminent pathologists in Germany. Pity this research hasn't been done in other countries. We've been calling for it for a long time. But there we go. That is the picture. Damaged heart muscle cells with the lymphocytes. And let's make it quite clear, these lymphocytes are not supposed to be there. And of course, the heart muscle cells are supposed to be healthy, not damaged. Here's another picture here. This is CD68 positive macrophages. Don't worry about too much what the histopathology is here. But the macrophages are another type of inflammatory white blood cell. And here we can see the dark areas here are the macrophages. And we can also see damaged myocardial cells here. This evidence is definitive and basically non-controversial. It's definitive pathological diagnosis of vaccine injury. And I think we need to say here, because of the regulations we're working under, these are recognized but rare complications. That's the specification. We're allowed to talk about recognized rare complications, and this is what we're talking about, and we can see the pictures here. So we can see that quite clearly. Now, the next one is in lower power, and it's CD4 positive lymphocytes. In other words, they're what we call T helper cells. You'll have heard of these ones because these are the ones that are affected by the human immunodeficiency virus. And this is lower magnification. So what we see is this is myocardium here that looks okay, the heart muscle here that looks okay. Then we see an area of infiltration there, and we see another area of infiltration there. So we see that the situation is focal. This is a focal pathology. And the trouble is with this focal pathology is you get abnormal electrical activity in these areas. And these are it's what we call an ectopic focus, and that can start off all sorts of impulses that can lead to a condition called ventricular fibrillation. And if you're not in a hospital situation with a defibrillator to hand, you're going to die as a result of that. And of course, all these patients were found dead unexpectedly at home. So that is pretty definitive evidence there. Now, I don't want you to take my word for this. Of course, as always, check the sources yourself. It's the research of clinical research in cardiology, and it's the official journal of the German Cardiac Society. It's called Autopsy-Based Histopathological Characterization of Myocarditis After Anti-SARS Coronavirus 2 Vaccination. That's the link. You can download the PDF. This is peer-reviewed. This is proper science and definitive pathological diagnosis by a group of leading German pathologists. Basically, these people are doctors who specialize in pathology. This is what they do. And they were very exacting. They're very exacting the way they did this. I'm going to show you that now. It's very good science. So they did what they call a likelihood assessment of vaccine epimyocarditis. So what they found was there was a lot of epicarditis. Now, you've got the myocardium, and on top of that, you've got the epicardium, which is actually the inner layer of the pericardium, then the tough fibrous pericardium on the outside. So a lot of this pathology was near the surface of the heart. So it was epimyocarditis that they found. Is this a causality or a correlation, of course, is the question. Well, they took the presence of myocarditis with temporal association to vaccine event, and that temporal association was in 28 days of an mRNA vaccine, and they eliminated other pathology and integration of histological phenotype. That's basically what they see under the microscope. Clinical presentation, that's what they see in the patient. And then they had the full case details. The reason they did these 25 patients, well, they had the full clinical details, everything was in hand. The patients have been found at home. Laboratory findings indicating no alternative differential diagnosis. So we can be fairly sure that these are causal. No, we can't be fairly sure. They think there's a high likelihood that these are causal, not a spurious correlation. And of course, that makes this a rather important video, to be quite honest. Now, abstract infographic that they give there speaks for itself.
So he's saying this, he's directly linking here. He's saying most likely this is the cause. That's what he's saying. Okay.
The virus, the spike protein from the mRNA vaccine getting into the heart, leading to these cardiac arrests. So what happens is the ectopic focus starts behaving in an
Let me back that up again.
Now, abstract infographic that they give there speaks for itself. The virus, the spike protein from the mRNA vaccine getting into the heart, leading to these cardiac arrests. So what happens is the ectopic focus starts behaving in an electrically erratic way, gives off impulses to the myocardium, and instead of contracting meaningfully, the myocardium just fibrillates, and basically that cuts off the blood supply to the myocardium, it cuts off the blood supply to the brain, because your blood pressure essentially goes down to zero, and death ensues within minutes of this situation. Unless someone's there to actually shock you with a defibrillator, well, you don't do that anymore. They tend to be automated. But unless someone actually defibrillates you, and in ventricular fibrillation, you're going to die. Ventricular fibrillation causes death, unless it's treated with a defibrillator. And in the course of these cases, it wasn't, because tragically these patients were found dead at home. So they've been clinically diagnosed, or the patients have been found dead at home. Laboratory tests, this is in the past. In the past, cases of myocarditis have been diagnosed clinically by laboratory tests or imaging. But here we have definitive histopathological diagnosis. You can't argue with a photograph that's taken under the microscope. So this is really adding to the evidence that we needed to consider this thing objectively. In the context of mRNA-based anti-SARS coronavirus 2 vaccine. Now, this is autopsy-based. We describe cardiac, heart autopsy findings and common characteristics of myocarditis. So they found characteristics of myocarditis, but they also found these inflammatory cells with this time correlation from the vaccine, but they eliminated other causes of pathology, other causes of disease.
So he's saying this happened within 28 days of them getting and that they've eliminated other causes.
Oh, Area Man reads one article. Now he's a scientist.
I'm sorry, I'm doing my own research.
As much as they could. With vaccine-induced myocardial inflammation representing the likely or possible causes of death. So it's best that I let them speak in their own terminology without me putting words in their mouth, without me overstating or understating. This is what the pathologist said in their paper. Vaccine-induced myocardial inflammation representing the likely or possible causes of death. Well, you could certainly see the inflammation because the cells were there that caused the inflammation. I mean, it's good to have inflammation, of course, in the right circumstance. Heat, pain, redness, swelling. If you twist your ankle, that helps it to heal, or if you have inflammation around a wound, that helps it to heal. But this is pathological, immunologically induced inflammation. Because it's in the myocardium, it's such a critical area that's almost certainly caused the death of these people. But again, using their own words, likely or possible cause of death, our findings establish the histological phenotype, what it looks like in the real, tragically dead human being of lethal vaccine-associated myocarditis. So again, choosing their words carefully there, lethal vaccine-associated myocarditis. Standardized autopsies, 25 persons, 25 bodies found unexpectedly dead at home. So these people were not expected to die, but they were found dead at home. And some of them were able to identify other causes. So they actually had a bigger sample. They had 35. For 10, they were able to identify other causes of death because, of course, people sadly do die. But these 25 were suspect, but there was 5 where they were had this very high index of suspicion. So bodies found dead at home within 20 days of vaccination. And now I expected these to be young men. Male 46, female 50, female 62, male 55, female 75. So these are a wide spectrum of the age range. And I expected more men than women. And what we've got there is we've got 3 females and 2 men. Okay, it's a small sample size. They only had the people that were found dead at home to analyse. But that's what they found in that sample. Histology, there was patchy, focal. So it's patchy. It's not all the heart muscle, just part of it. It's focal. That's what gives rise to these ectopic foci. This is why this is so dangerous. Interstitial means it's in the tissues. Myocardial means it's in the myocardium, the beating contractile muscle of the heart. T lymphocyte is the type of immune cell that gets in there as a result of the immunological reaction. And macrophages are another type of white blood cell and immune cell that get in there as a result of the inflammatory response. It's these cells that actually facilitate the inflammatory response. But the point is these cells aren't supposed to be there. This is a pathological finding. These are not supposed to be there. This is what almost certainly caused these people's death, predominantly of the CD4 positive series. So these are the type of T lymphocytes, the T helper cells that are stimulating the other cells and stimulating the inflammatory response. And as we said, inflammation is good in some circumstances, but not when it's caused by a pathological immunological reaction, especially if it's in the myocardium. So autopsy findings indicate death due to acute arrhythmogenic cardiac failure. So arrhythmogenic, a dysrhythmia or an arrhythmia means that the heart is not beating properly. And that they've said it's an acute arrhythmogenic. So in other words, it's the arrhythmia that caused the heart failure. So the arrhythmia, the heart is just fluttering and the heart just stops. The blood pressure drops to 0. There's an acute heart failure followed a minute or 2 later by death. So these foci of inflammation, where these macrophages and lymphocytes were where they weren't supposed to be, is almost certainly what caused the fatal arrhythmias. And because there was no one there to treat these patients, they were simply found dead at home. Thus, myocarditis can be potentially lethal complication following an mRNA-based anti-SARS coronavirus vaccine. Now, this is a direct quote from the peer-reviewed journal of the German Cardiology Society. Simply direct quote of peer-reviewed literature by a group of 6 senior German pathologists. And I think I'm allowed to say that because we are allowed to talk about rare recognized events, because myocarditis is recognized by the WHO and the CDC and the UK various authorities as a potential side effect. But here we have the histopathology that proves it definitively in quite a high number, 5 out of 25 deaths. Our findings may aid in adequately diagnosing unclear cases after vaccination. For goodness sake, if people have been vaccinated, let's have a high index of suspicion that this may occur, even if the information was mild, and the information was fairly mild in most of these cases, affecting a fairly small area of the myocardium, not enough to affect the contraction of the myocardium on its own, but because they are electrically unstable, they call these ectopic focus. There's a focus of electrical activity where there shouldn't be one, and the person basically just drops dead. Let's not minimize it. So, in a sense, these patients had mild myocarditis. But if you ask them or their relatives, they probably wouldn't think so, because even though it was mild, it was enough to kill them, because by definition, they were all post-mortem autopsy findings. Our findings may aid, so yes, have a high index of suspicion for these things, doctors and nurses out there, please. And thus establishing a timely diagnosis in vivo. We want to diagnose in life, in vivo, when people are still alive. Monitoring the framework for providing a framework for adequate monitoring and early treatment of severe clinical cases, and indeed mild clinical cases, because even milder cases, all you need is an area of ectopic electrical activity that can cause ventricular fibrillation, and that is what can cause death. So there we go. And this is basically a smoking gun. Let's look at it again. We see the abnormal cells in the myocardium causing the damage. It's unequivocal. It's pathological diagnosis. There again with a different cell type. There again with a different level of magnification, showing the pathologically damaged areas of infiltration that can give rise to the ectopic electrical focus, which can give rise to the ventricular fibrillation, which causes death. I'm going to leave it there because it's we're talking about people's lives here. Okay, thank you for watching.
Jackson, are you surprised? First of all, I'm surprised he was allowed to say that on YouTube. Apparently he was. I have to cover my ass and say that no matter what he said, the vaccine is safe and effective. It only has
more shots, I would say.
It only has rare side effects, and that it keeps you out of the hospital over getting sick or dying. So it's fantastic.
Give it to your kids.
Give it to everybody. So Jackson, what do you have to say with that? Anything?
Well, peanuts are not safe and effective for 8 billion people on this planet.
Was that how many people have peanut allergy? 8 billion?
I mean, all 8 billion. It's not all.
Oh, that's right. Oh, I got it. Yeah.
Lobster, crab, these things are not safe for all 8 billion people. But the vaccine is.
It definitely is.
Definitely is.
Luckily,
definitely is.
And it's a real miracle when you think about it, because they did this one a lot quicker than usual.
Yeah,
to get one this good. I mean, not even half the time.
Right. Not even half the. Usually it takes 5 to 10 years. They get one done in like a couple of months.
I mean, it's a real rare to get something this good. I don't think we need to look a gift horse in the mouth for its myocarditis.
Right. I mean, I don't know why this guy's got to be such a Debbie Downer about this.
Oh, Area Man thinks he's a doctor because he has a degree.
Because he has a PhD.
Area Man.
Area Man. I hope you understand that what we're doing here is this is called doing your own research. I'm listening to a PhD talk about a clinical study from Germany.
Oh,
so we're not supposed to do this.
So that makes you a doctor because you listen to a doctor.
We're not supposed to listen to doctors. We're not supposed to read clinical studies. We're not supposed to do any of this. This is bad for you. This is bad. This is called doing your own research, which is bad.
Ask your doctor about medicine. That unless we tell you not to ask him, then shut your trap and don't ask him about it.
Please ask your doctor about medicine. Don't ask your doctor about ivermectin. Whatever you do, don't do that.
But go ahead and ask him about other stuff, but not. We'll tell you what to ask him about.
We'll tell you. You ask him about the drug that keeps your leg from shaking, but don't ask him about the.
Ask your doctor to give you a drug so your leg doesn't shake.
Ask him if he can give you a drug that makes you have a compulsion to gamble. But other than that. Like, that's okay. That's a side effect to a drug. It makes you want to.
Don't let me catch you asking your doctor about that other horse one.
Please stop fucking reading, folks. It's bad for big pharma profits. Hey, we're doing live stand-up comedy in Los Angeles, December 9th, 16th, 23rd, and 30th. And we're going to be in Tempe, Milwaukee, Minneapolis, Nashville. Go to jimmydore.com for a link for all those tickets. See you there.